About 12 years ago, I became licensed to use lasers for hard and soft tissue in dentistry. And in fact, I purchased a hard tissue laser, and it was supposed to be able to be effective to clean out cavities. And it worked, but it was very uncomfortable. And in fact, I ended up donating it to South America. But when this year we were introduced to the Layers AT, we found a piece of equipment that was able to be used to drill out cavities comfortably, with no shots, no drilling, and have a patient get out of the chair and say, wow, that was amazing.
Coming in today, I was expecting to get beat up a little bit. You know, shots, I've been through this process before. You know, sometimes it's not always the best, but the laser, things were very quick, painless, efficient. It was a good experience, and glad to know things are up to date these days.
We use lasers for adults and children. The laser makes fillings faster and more comfortable. For kids, these pleasant early experiences will carry them into their adult lives with a positive attitude towards dentistry. The laser is so accurate that it can precisely clean out decay, leaving more healthy tooth structure than when using a drill. This fits right into our concept of biomimetic dentistry. Studies have shown that up to 99% of children were so comfortable with the laser that they didn't need an injection. One of the greatest benefits is that the laser not only eliminates decay neatly and quickly, it also sterilizes the cavity, virtually eliminating the bacteria present. There is less pain because as the laser cuts, it seals the nerve endings. The main reason that people put off going to the dentist is fear. They fear the drill, the needle, the pain, the noise. With the laser, many of these concerns can be eliminated. By eliminating the sound and vibration of the drill, adults and children are more relaxed. How does a laser work? A laser uses a high-intensity light beam and sprays water in front of it. The light hits the water molecules, creating tiny waves of acoustic energy. It is these sound waves that do the actual cutting in comfort and safety. Laser dentistry is useful even for very large cavities. Because of the ability of the laser to sterilize virtually everything it touches, laser dentistry can ultimately prevent decay from spreading to the nerve. Besides using the laser for treating cavities, we use a laser for treating gum disease. In fact, we're able to avoid gum surgery through using the laser. It's a fantastic technique that uses the sterilizing ability of the laser to eliminate the bacteria deep in the gum pockets, help the pockets heal up, and get the patient comfortable, more comfortable than they were even before they started. Diagonodent is a laser that we use to find cavities. In fact, we use the Diagonodent to find cavities even when women are pregnant. We don't have to worry as we do with x-rays. The Diagonodent laser is completely safe. One of the greatest things about coming to work in the morning is the excitement that I feel every time I use a laser. I get excited about it. My patients get excited. They know that this is a new technology that's making their life more comfortable, and it makes it easier for them to have their work done. It makes them not want to avoid coming to the dentist, but actually look forward to it. I look forward to coming to work because I know that I can make more people happy with the technology, and I have a staff that helps me make sure that the patients are comfortable throughout the procedure.